Hello, everyone.
Hi.
It's me, Elisa, and I am here with Jennifer from National Capital First Aid. And I'm really excited for tonight's discussion. So, Jennifer, do you want to tell us a little bit about yourself?
So thank you all for being here with us tonight. As Elisa mentioned, my name is Jennifer Cybrandy. I've been a registered nurse with the Ottawa Hospital for the past 13 years. I'm also the owner of National Capital First Aid, which is an affiliate of the Red Cross, and the proud mother of 8-year-old twin boys. So what we do is offer a very special class called First Aid for Parents and Grandparents. And what we will be going through tonight is part of the class that we teach.
I went to the class. Well, actually, I had them come to my house. It was the best class I have ever taken. They came over to my house, and I made all of my family members that would ever look after my children come. So it was fantastic.
Oh, thank you.
You're welcome. Thank you.
So if at any point anyone has any questions, please just type them in. Lisa has her phone with her, so
Yeah.
she can see what you're asking, and then I will be able to answer your questions.
Okay.
All right.
So if anyone here yet? Have we got anyone? Pam? Pam, are you there?
There we go.
We'll see. Okay. So I'm just going to keep my phone on me. Have we got anyone? Pam?
Okay.
Okay.
So if you'd like to join along with Lisa and I to participate in the demonstration, please do. Do not use your real baby, okay? You can use a stuffed animal or a doll. I have here with me Olaf. That would work fine. Something like this, Eeyore, or my personal favorite,
flimsy here.
Mr. Buzz Lightyear. So,
Okay,
Elisa?
I'm going to use Buzz.
Perfect.
For today.
Okay, and I will use a baby mannequin. Okay, so in first aid, an infant is anyone aged 0 to 1 years old. And this actually has nothing to do with their age, but everything to do with their size, which will make sense a little bit later. So let's first define what choking is. Okay. Choking happens when there is an obstruction, either partial or complete, in any part of the airway. And the airway is the passage from the nose to the mouth to the lungs. And when we speak about choking, we speak about two kinds, mild and severe, conscious and unconscious, as it relates to infants and children. So tonight we will be covering the mild and severe conscious choking as it relates to infants.
Okay.
So
mild choking is, like, for an example, if they're coughing, or if they look like they're doing that, that's mild, or is that severe if they're like,
Okay, so mild choking happens when there's a partial obstruction in the airway. Okay, so there's still air getting to your baby's lungs, but they have to clear it out of the way. If your baby is coughing, screaming, or crying, it is mild choking. Okay. Even if they're coughing so hard that you're thinking they cannot possibly be getting in enough air, I promise you it is mild choking. Okay. Remember that day you were on the couch and you decided to take a drink?
Yes.
And it went down the wrong hole?
Happens all the time to me.
Okay. It goes down the wrong hole, and what do?
Cough.
Right.
Get up.
Pretty much. You jump up, lean forward, and cough, right? And that is all you need to do for mild choking. Okay. When our baby is mildly choking, they're normally feeding in this position. Okay. And if it goes down the wrong way, what's the first thing we did on the couch?
Got up.
We got up. So we're going to have to help our baby get up. Okay? So we're going to sit them up. And if they're really little, we're going to hang on to their head. You don't have to be crazy. Nothing like this. Nothing like this.
Hold Buzz Lightyear's head. But okay.
So you're going to hold them like this.
Okay.
And you're going to let them cough. Okay? So that's it. Let them cough. Okay. Some people say you have to teach your baby to cough. You do not. Okay? Coughing is a reflex, and your baby will know what to do. Okay. So what happens when we're coughing is that we are pressurizing our abdomen. Oh, if that happens at home, call 911. Okay, my baby's head just fell off. When you're coughing, you're pressurizing your abdomen, and then when you cough, you're compressing your lungs to move whatever's in the way out of the way. Okay, that's what a cough is doing. And our baby needs to do the same thing. Okay. So if there's one thing I want you as parents to remember is that you're not to interfere when your baby is mildly choking. Okay?
So no lifting up of the arms, No patting them on the back.
Okay, so this lifting of the arms, everybody watching, just humor me for a second. Cough. Now good. Now put your arms up and cough. That's actually harder, right? That probably didn't help you any, so no need to do that.
Okay.
Now this, okay, is our go-to as parents. Okay, this is fantastic for burping, dangerous for choking. Okay, so parents, no more of this. We don't tap our baby in the back when they are choking. There's two reasons for this. Number one, you might lodge whatever's in the way farther down, and you might turn this mild choking into severe choking.
Okay.
The other thing is, imagine you're about to have a cough, and somebody hits you in the back. Like, they just took away your ability to cough, right?
Yeah.
Thanks for nothing, right?
Okay.
So we don't do that to our baby.
Okay.
So no tapping. So let's recap. If your baby is coughing or crying or screaming, they are mildly choking.
Okay.
You lean them forward and hang onto their head and let them cough. All right? People say to me, well, how long is this going to take? I've had times where I was mildly choking and I'm coughing for 15 minutes. It's usually when I'm in a meeting or somewhere where it's
of course,
embarrassing.
Facebook Live. Hopefully that doesn't happen tonight.
But sometimes it's like 5-10 seconds. So stay calm. Your baby's going to be okay.
Okay.
They're going to survive this one. Okay? Okay. Any questions about mild choking this far?
I'm going to have to get up here and...
If you have any questions about what we're speaking about, feel free to send them in. If not, we are going to move on to severe choking.
Okay.
All right. So severe choking happens when there's a complete obstruction of the airway. So now there's no more air getting to your baby's lungs. What do you think your baby would look like if they were severely choking?
They'd be flailing around.
For sure, flailing around, right? They're not able to breathe and they're
Panicking.
So they are going to be flailing around.
Okay.
What is their face going to look like?
Perhaps turning different colors.
Like blue or gray.
Yeah.
Okay, your baby will be turning blue and purple pretty quick. Okay, the eyes are probably going to be bulging out of their head.
Okay.
If you see your baby in the high chair smashing and there's no noise coming out of their mouth, that's a pretty good sign that they're severely choking. Okay? When your little one is severely choking, they are not crying, coughing, or screaming. There might be a high-pitched noise, like ee. That is still severely choking. Okay? Now, we have to do something, because if we don't intervene, things are going to go bad pretty quick here.
Okay.
All right, so this is where you can play along at home. You need to be sitting down to do what we're going to do. If you're somewhere like at the park and there's no chairs, you can get right down onto the ground, okay? Onto your knees.
On your knees?
Yeah.
Okay.
Okay.
So I'll do the on the knees.
Okay, sounds good.
Okay.
So your baby is severely choking. You're going to pick them up, and now you're going to do something that feels unnatural, and that is to turn them away from you. Okay? You're going to slide your arm through your baby's legs, so they're sitting right on the crux of your elbow. Okay. And you're going to grab their face or their cheeks. Perfect. Okay.
Like this?
Just like that.
Okay.
Okay. If I was at home with you, I could almost guarantee that a quarter of you are either holding baby's face or their neck. So you want to make sure to avoid that. You're really holding on to their cheeks. Okay. And remember, your baby is fighting you right now. And your baby's probably heavy, okay? So you're going to have to really hang on to them.
Okay.
Now, a side note, remember I was saying that an infant is aged 0 to 1?
Mm-hmm.
What I mean by that is if you are able to hold your baby like this, it's an infant, okay? If you can no longer hold your baby like this, you're going to have to treat them as though they are a child. And that is a completely different technique, but you cannot do it this way. So when my boys were 11 months old, I could not hold them like this. They were too big. I was like down here.
Okay.
But my husband, who's 6'1", no problem.
Okay.
He could
So
still
it
do
can
this.
differ from person to person as well then.
For sure. So
depending on who. Okay.
At 11 months, I had to treat my boys as though they were children and do something different, whereas my husband was still doing it like this.
Okay.
Okay? All right. Then you're going to sandwich your baby, okay? Make a baby sandwich. And put your baby down on your knee. The head of your baby should be pointing down, okay? Because gravity is our friend in this
I'll get up
situation. Okay. Now, with the heel of your hand, you are going to do 5 firm back blows. In other words, you're going to hit your baby 5 times, firm between the shoulder blades. Okay? We don't want you skidding off the back like this. It is a straight down motion.
Okay. So would this be Buzz Lightyear's
right between
shoulder blades?
Right between the jetpack and shoulder blades.
Okay, perfect.
So we're going to do it 5 times. So just watch first, okay? 1, 2, 3, 4, 5. All right?
Okay.
Now, most people are like, you want me to hit my baby that hard? Yes. Okay, this is not a game. We're not fooling around here. It's not a massage. You have to hit your baby this hard in this circumstance.
Okay.
Never would we advise anybody hits their baby this hard, but this is now a life or death situation, and we have to clear that airway. Okay?
And so how do you know how much force to use when you're...
Computer glitch. We're good?
Oh, we're good. Okay.
All I can say is you're going to hit forcefully. All right?
Okay.
So let's try that together now. Ready?
Yeah.
So 1, 2, 3, 4, 5. Good. If it comes out after the first back blow, you do not need to hit your baby 4 more times. You're done. Okay? And you'll know that the object came out because your baby has not had a breath now for however amount of time, and they are going to scream and cry. Okay? Then you can pick them up and cuddle them.
Okay. If they're
You're
not,
done.
and then if they're not crying...
Side note, even if it does come out, you should probably take your little one to the hospital.
Okay.
There was an object that was stuck where it shouldn't be. And when it came out forcefully, and something could have torn or ruptured, and there could be swelling later on in the day. So you just want to make sure that everything's good.
Get them checked out.
Okay. All right.
When are we calling the ambulance within this time frame?
This is a good question. So the Red Cross says that if you are not by yourself, you should have someone call 911 as soon as it becomes severe choking.
Okay.
Okay. They say that if you're by yourself, they actually want you doing 2 full minutes of unconscious choking before stopping, because they want you fixing this airway problem and not leaving your baby to go get help.
Okay.
But if you can, send somebody to call as soon as it becomes severe.
Okay.
Okay, so we just did our 5 firm back blows. Are there questions popping up there, Pam? Sorry, Elisa?
Yes. Okay, so we don't have any questions yet, just comments that we can go over after.
Okay, sounds good. So we just did our 5 firm back blows, and if it did not come out, you're going to sandwich your baby again, and you're going to flip them to the other knee, okay? Now,
to the other knee.
To the other knee. You're going to draw an imaginary an imaginary line between the nipples. Okay. And then you're going to put 2 fingers just below the nipple line. Now we're going to have to squish our baby. And remember I was saying that when we cough, we're pressurizing the abdomen, then squishing the lungs. This is what we're doing by pushing on the chest. We're squishing the lungs to push whatever air is in there up and push the object out of the way.
Okay.
Okay?
And they're still flailing and conscious at this time.
They're still conscious, and they are definitely flailing.
Yeah.
Okay? So we're not going to be pushing with our wrist. We want our elbow in the air because we're going to have to use our muscles here, and we're going to squish our baby.
Okay.
Now, people always say, how hard do I squish? This one is measurable.
Okay.
The Red Cross says that on an infant, you're going to push down 1.5 inches, 4 centimeters, or half to the third of the depth of the baby's chest.
Okay.
Now, what does that mean? In simple terms, you're going to squish your baby in half.
Okay.
That's intense, right? Like, that's pushing really far. But that's how much you have to squish to be able to compress the lungs. So we're going to squish our baby in half 5 times.
Okay.
Okay, so 2 fingers just below the nipple line, elbow up, and squish. 1, 2, 3, 4, 5. Perfect. Okay? If it came out, excellent, you're done. You're still calling 911 to get them checked out.
Okay.
If it did not come out, sandwich your baby, hold on to the cheeks, flip them, and we're going to do 5 more back blows. Ready? Let's go.
Yeah.
1, 2, 3, 4, 5. Flip your baby. 1, 2, 3, 4, 5. Flip your baby. 1, 2, 3, 4, 5. Flip. 1, 2, 3, 4, 5. Okay? Everyone gets the picture? You're going to alternate between 5 back blows and 5 chest compressions, over and over and over. Okay. How long are we going to do this for? Elisa?
I do not remember.
Okay.
This is terrible. I need to take more courses.
So how long would you be doing this for if you were at home?
5 minutes, 10 minutes, 2 minutes.
So a lot of people say, I'm going to do it until 911 gets there. Well, how long can you hold your breath for? That's pretty much how long your baby can hold their breath for.
Okay.
And your baby will not stay conscious until the ambulance gets there.
Okay.
Here in Ottawa, it takes on average 6 minutes for an ambulance to get to you, and your baby will probably hold their breath for a minute, okay? So you're going to do this until one of 2 things happens. Until the object comes out and your baby starts breathing, or your baby goes unconscious.
Okay.
One of these 2 things are going to happen, okay? If your baby goes unconscious, you have to stop and put them on the floor. And we are now dealing with unconscious choking, which has to take place on the floor.
Okay. And then at this point, you go and call 911.
No. If you are by yourself, you have to do 2 minutes of
right.
unconscious choking
Okay.
first. If you're not by yourself, 911 has already been
Right.
called.
Yeah.
The good news is you'll probably never have to deal with this, okay? Hopefully it'll fix itself at the mild choking stage. If it goes to severe, you now have the tools to know what to do, and you'll hopefully fix the situation, right?
Okay.
Now, how are you going to know that your baby went unconscious?
They are no longer responsive. Their eyes are now closed. They're not flailing anymore.
That's it, okay? Because you're not going to notice their eyes or how reactive they are. They're going to stop fighting you, and they're going to go limp. And that's how you're going to know that your baby went unconscious and you're on the floor now. Okay? Okay, so are there any other things you'd like to speak about choking hazards or foods? If you have any kinds of questions, send them in.
Okay. I would like to know a little bit more about, things that we might not even know that are around our house that are big choking hazards, or, particular foods that might be bigger choking hazards.
Okay, so in the early days of infancy, the biggest choking hazard is probably going to be phlegm or formula or breast milk. My husband actually had to do severe conscious choking on one of our sons when he was 1 day old at the hospital because he choked on his phlegm and it was severe choking and he went blue.
Ooh.
In the
This
months,
happened to my daughter as well.
Scary, right?
Yeah.
In the months to follow, the more common things that your infant is going to choke on is going to be food. So the Red Cross suggests that we feed our little ones soft, cut-up foods, okay? Smaller pieces. The bigger the pieces, the higher chance of choking. Anything that your little one can put in their mouth, which is unfortunately everything they can get their hands on when they're little, is a choking risk. So you want to keep small toys or small pieces away from them. Money is a big one, because what happens is little ones swallow coins, and I've actually seen this on an x-ray at the hospital. So they swallow a coin, and it's stuck in their esophagus like that, and the fear is that the coin flips, right? And then it occludes the airway. So any foods that are kind of that size or shape is kind of scary too, like grapes, right? That's like the size of the esophagus. So you want to make sure that foods like that are cut up into quarters, so that if they swallow it before chewing it, and it ends up going down the wrong hole, that it's a smaller, manageable size. Okay. Another thing is the top of milk bags. You know those little snippets?
I'm terrible. Before I took the class, I was terrible for cutting the milk bag, and poof, it would fly everywhere, and I just, out of sight, out of mind, I'll sweep it up later when I sweep.
So that is actually a big one. And parents wouldn't think that, but that little tip is a plastic funnel. And picture if that little plastic tip gets into your baby's airway and then they breathe and that thing opens and seals the airway shut. Those are really dangerous. So when you snip the top of your milk bag, make sure you put it into the garbage right away.
Yeah. Okay. Which is what I do now.
Right on. For toddlers, when they're coming out of that infant age, also minimize the other activities that are happening during eating. So make sure that your little one is sitting in their high chair, okay, that they're not running around and playing, that they're not being distracted with something funny and laughing. Like eating at that age should be the sole activity.
Okay.
Okay.
Yeah,
Great.
so not running around while eating and yeah. Okay. All right,
Perfect.
so I'm going to check and see if there are any questions. Okay. Okay, so we've got Lara. We have some people that are saying hi and just great
Hi.
demonstration. We've got Lara who 2 minutes of unconscious before I stop and call 911 if I'm alone. So
Okay, so to clarify on that, the unconscious choking is a whole other class, but you would basically be doing unconscious choking technique on your infant for 2 full minutes before stopping what you're doing to call 911. The reason being is that infants and children usually go unconscious and have cardiac arrest because of choking or drowning, unlike us adults who have cardiac arrest because of lifestyle and cardiovascular disease. So they think that this is something that we as parents can fix at home. So they don't want us leaving the baby to go and call 911, okay? This is valuable time that they don't want us wasting. That being said, if you do have to leave to call, take your little one with you because they're portable. Call, and then you keep going wherever you are, okay?
Okay.
Now, the Red Cross does not take into consideration that we have smartphones.
Right.
So, I mean, if you're ambidextrous and you can have your phone call for you while this is happening, go for it.
Yeah. Okay.
All right.
All right, and then we have, I have a question about food safety. Until what age should we be cutting foods into small pieces?
Okay. So that would be a fantastic question for your family doctor or GP. I cut my little guy's food in small pieces for over the first year. I have a hard time remembering how long because they're 8 now, but as long as necessary. Definitely.
People make fun of me because I still cut my 5.5-year-old's grapes.
I cut my husband's grapes. So definitely check with your family doctor for the age on that.
Okay, and then hot dogs, like,
Again,
is it 5.5? I'm still, if I ever give her a hot dog, it's like cut, sliced down, and then chopped.
you're going to have to use your judgment on that.
Okay.
But again, you're not going to introduce something that's big that can get stuck when they're not able to chew. That's the scary thing, right?
Right.
At 5 years old, your child can chew and swallow. So if they're choking on a hot dog, it's because they're probably running around
Right.
or laughing
Or
doing other
laughing,
things,
yeah.
right? Okay. So
Okay.
while Elisa
Which
is
usually
looking,
when we have hot dogs, it might be a situation where she's laughing and playing because it's usually at a party or something.
or barbecue.
Yeah.
So while Elisa is looking for the next questions, I'll just take a minute to speak to you about our First Aid for Parents course. So if you'd like to learn more about what to do for children, because your infant is only an infant for 12 months, you can join us at the Birth and Wellness Center monthly, or if you'd like to know what to do for unconscious choking, or a variety of other topics that we cover, that's very useful information, like how to clean cuts and scrapes, what do you do for bruises, allergies, oh my god, that's a big one, asthma, eye injuries, ear injuries, burns. We cover a lot of useful information. And then we also talk about the kind of things we're talking about this evening, the big scary stuff that hopefully you never have to deal with. But if you do, at least you will have a plan. Okay? We also offer private in-home courses, as Elisa was mentioning, to groups of 8 or more. So if you are interested, you can have a look at our website at nationalcapitalfirstaid.com. And you can book your class directly online.
We'll post the link to it after as well. We have someone who has asked, what is done for unconscious choking? Compressions?
Okay, so that, like I said, that's a completely different topic. We won't be speaking about that tonight because that would probably take another 20 minutes to go through properly, and I don't want to give you bits and pieces of information without completing the puzzle. But yeah, so I'll just stop there.
Okay. And then we have someone who said that they even cut blueberries, which, as do I.
Good for you.
Does that surprise you?
I always say safety first, so I think cutting blueberries is fine. Cutting cheese into small pieces, that's okay. Yeah.
Carrots, like raw carrots, if you were to give your child, let's say 5.5-year-old raw carrots, what are we, like, is it,
again, if your
should
child
you cut them?
If your child has teeth and they can chew and they're not doing any other activities, I wouldn't be over paranoid about feeding them foods. You know,
Okay.
you will find your middle ground between crazy safety parent and laissez-faire parent. It's somewhere in the middle.
I might be a little bit of a crazy safety parent when it comes to choking. I'm a little over paranoid about that for sure, but yeah.
Good.
Okay.
I think another question may have popped up.
Okay, I'm gonna check. This has been fabulous. Thank you.
Thank you.
And then, me too, would rather cut than save a life.
There we go. For sure. Okay, so if you'd like to join us at a future course at the Birth Center, another thing that I could mention is that it's extremely affordable. It's only $30 per participant. What we did is that we took all the information from the 2-day course as it relates to infants and children and put it into a 2.5 hour format. And by offering it as a non-certification course, so no card, no book, we can drastically reduce the time and cost associated with completing the course. Because this is not the kind of course that you take for work or school. It's the kind of course that you take to know what to do. And the whole purpose of the course is that we want parents and grandparents to feel confident or more confident in what to do in different emergency situations, but also knowing when it's time to call 911. And this is a fantastic course for grandparents or anyone who will be looking after your little ones, because first aid changes, right? It changes a little bit every 5 years. So my mother has taken the course 3 times now, and it's a good refresher.
Mm-hmm. Yes, I'll be taking it again, that's for sure.
Okay.
Okay, so I think that's it for the questions, but
Perfect.
you know, if anyone has any questions after, then
we will be sticking around offline to answer any other questions you may have. Yeah.
All right.
You
Sounds
did
good.
great, Elisa.
Thanks everyone. So did you.
Have a
Thank
good
you.
night.
Bye.